Welcome to today's weekly national news briefing in partnership with the California Department of Aging. I'm Sandy Close, Ethnic Media Services Director. A recent New York Times columnist wrote that we are no longer facing a pandemic of unvaccinated, we are facing a pandemic of older adults. More than 22% of Californians are over the age of 65. 70% of deaths from COVID-19 are of people aged 65 and older. Nationwide, the figures are worse. 81% of COVID fatalities are of people 65 years and older. And older adults are also struggling with multiple viruses, including COVID-19, RSV, and the flu. Today's briefing focuses on how California, the state with the largest population of older adults, is taking the lead on care for elders and those with disabilities, especially amid this winter COVID tridemic. Speakers will discuss harm reduction measures such as masking, testing, and simply staying home. Speakers will also share resources that the state provides for older adults, people with disabilities, and family caregivers. The state of California is looking to the future, and California's master plan for aging affirms the priority of the health and well-being of older Californians and people with disabilities. It is a blueprint to California's leadership in aging, disability, and equity. In my words, it's a veritable declaration of war on ageism and ableism. We believe these programs may offer models for other states, and we welcome questions from our media from outside California. Our speakers today include Susan Day Morris, Director of the California Department of Aging, Dr. Tomas Aragon, State Public Health Officer and Director of California Department of Public Health, Anna Acton, Deputy Director of Independent Living and Community Access Division, the California Department of Rehabilitation, Jessica Lehman, Executive Director, Senior and Disability Action, and Dr. Donna Benton, Director, University of Southern California, Family Caregiver Support Center. Reporters, please enter questions in the chat box, and we will take questions today at the end of the briefing. We will also send a media advisory, as some of you have requested, right after or within an hour of today's briefing, along with a video of the session to all
캘리포니아 Department of Aging과 공동
and extended bios of our speakers. Speakers, please speak slowly for our interpreters in Spanish, Korean, and Mandarin. And now we will begin with Dr. Aragon from the California Department of Public Health.
Thank you very much. I'm going to go ahead and put up some slides, and I'm going to just jump into my presentation. Okay, so everyone should be able to see my slides right now. Okay. I'll start with the very first one. So, you know, for the past few weeks, we have been dealing in California, but really across the United States, with an increase in viral infections, impacting really all ages, and impacting also our kids. So if you look here, this here is the percent positivity for RSV. And if you look at over on the left-hand side, this is the percent of specimens that are testing positive. This time of year, people spend more time indoors. It's colder. You get infected. We expect viral respiratory tract infections to go up. You see there on the left-hand side, you see those orange circles. Those are the kids, and testing is more commonly done in kids. If you go down to the bottom, you'll see you'll see the red circles. Those are adults. The good news is that it has peaked. We're keeping our fingers crossed. RSV came early this season, but it is going down. But unfortunately, influenza took over, and we haven't seen influenza going up, and that's going to be in the next slide. So this slide here represents weekly influenza hospital admissions looking at different years. So that big orange peak, that was in 2017, 2018, when we had a big epidemic of hospitalizations from influenza. If you look over on the left-hand side, you'll see that dark curve. It looks like we've also begun to peak some with influenza. So that's good news. Again, it just like RSV, it's come early. One of the things we've seen with influenza in prior years is that you have an initial peak, it goes down a little bit, and then it goes back up. So we're not out of the woods at all. And you can see that in the other curves where you see it's really, the hospital admissions last for a longer period of time. So that's what our expectation is. Here in California, this is just from our data dashboard, the most recent one that we have, and this is for COVID. And you'll see on the left-hand side is while we've given a lot of vaccinations, we've been very successful in making sure that our population has received its primary series. Our challenge now is to have older people, especially those 50 and older, to be up to date on their boosters. This is really important because the subvariants of Omicron have developed the ability to escape immunity and to cause infection. All of us have waning immunity. In other words, our immunity goes down over time, even if you've been boosted or have had an infection in the past. And we're at that time of year where there's just higher risk. So for those reasons, it's really, really important for everybody to get boosted and to be up to date on their vaccines. Just like influenza, we see that there has been some peaking in terms of the test positivity and the cases and even the hospitalizations. And so we're keeping our fingers crossed that this will hopefully go down. Again, we still have a lot of winter ahead of us. And so it's impossible to completely predict. This is from the CDC community levels that gives us an idea of the risk of infection in a community. I want to tell you that this map here is based on hospitalizations. Hospitalizations begin to go up about 4 weeks after transmission goes up. So transmission precedes hospitalizations. So what we tell people is you have to realize is that you actually want to think ahead. So right now, even though you see here that 65% of the population in California is in a medium level, the truth is that means that there's really a lot of transmission. So if you combine both medium and high, we see that close to over 90% of the population in California is in a county where there's a lot of transmission happening. And so this is really important for us to take protective measures. And I'm going to be summarizing those in just a second. This is probably one of the most important slides that I want to present to you. I want you to focus on the right-hand side at the bottom, focusing just on California. There's 2 parts to this curve. The top curve is hospital census. How full are the hospitals? And what we do is the baseline is 100%. We have hospitals on average across California that are at 120% of their baseline census. That means that they're 20% above what they should be at normally. Our hospitals are packed, and they're packed not just with patients with respiratory syndromes, but also patients that have many other things just from delayed care. So if you go to the bottom, you see the burden of people who have COVID, that's the red curve, and people who have influenza, that's the blue curve. So you can see as those went up, you saw that the hospital census went up. So it's really an epidemic, not just of respiratory viral infections, of which COVID and influenza are only two. There's a lot of respiratory viruses. We focus on those because we can do a lot about them, but it's also an epidemic of just the hospitals being packed with patients who need care from all different types of diagnoses. And that's why the hospital systems are stressed. And imagine that also these infections infect healthcare workers. They're exhausted, they're tired, and they're sick. So there's also staffing shortages. So that contributes to the strain that the healthcare systems are experiencing. So in California, we have what's called the SMARTER plan, which is really sort of focusing on how do we manage all of this. And it's not just about COVID. It includes taking into account these other respiratory viruses. So we have a very integrated approach. Of course, one of those is vaccines. So if you look here at the primary series, as I mentioned, we've done a great job with primary series. Our challenge is right now is we need people to get vaccinated and to be up to date. So if you look here at the bivalent booster, of those that are eligible, only 30% people above age 50 have received their booster. So we need people to get vaccinated. It's never too late. It's a long season. If you're not up to date with your booster, it's great to do that. The other thing that we remind people is that in order to prevent infections, no intervention is 100%. Collectively, they do a job. So yes, get your vaccines, wearing a well-fitting mask that has good fit infiltration. Ventilation is important. This virus is airborne. You get infected by sharing airspace with people where the virus is concentrating, especially indoors. Opening the windows, opening doors, having good ventilation, doing things outside. Of course, getting tested and then getting treatment if you test positive and you have symptoms. I'm almost done with this presentation. I want to emphasize that the biggest risk factor for having complications, hospitalizations, and death for COVID is just age. So if you compare to 18 to 29-year-olds, go over to 50 to 64-year-olds, you see that the chance of dying is 25 times those that are 18 to 29-year-old. And it goes up to 60 times, 140 times, and 340 times. So age is a biggest risk factor. And of course, if you have medical conditions on top of that, it increases the risk even more. But age by itself. I'm going to end here by just reminding everyone is, again, get vaccinated against influenza and COVID. We want you to be up to date. If you develop symptoms, stay home. Make sure you test yourself for COVID. It's really critical to get on treatment. The best thing to do is to have a treatment plan before you become infected, because sometimes the healthcare systems or your provider may not be available. You want to have that plan ahead of time, especially if you're on medication. So you have a plan what to do, because the medications can interfere with each other. So you want to have the plan ahead of time. Of course, wear a mask. That's a reminder that COVID is airborne. It's in the air. It concentrates. So masking is important. Washing your hands, and of course, covering your cough if you have symptoms. And the easiest way to do that is to wear a good mask. And so that really goes a long way. So I'm going to go ahead and end there. I know that we will be providing information on how you can access treatment in California. We have a website, we have a phone number, we have telehealth. We have everything that you need to make sure that you can get vaccinated and also access treatment. So let me end there and turn it back. Thank you so much.
Dr. Aragon, do you have about 2 or 3 minutes to take some questions? We know you have to leave early for another appearance, but could I ask you a couple of questions?
Sure.
Okay, the first question is, I started with an introduction referencing a New York Times story, which was a national story, calling this a pandemic of older adults. Is that something that makes sense to you? Are we, in a way, looking now at the population most at risk, and therefore a series of prevention steps and protective steps for people my age? I'm certainly in the category of highest risk. And I'm just, how do I understand this if I see it as a pandemic of older adults?
Yeah, so, older adults have always been at higher risk for complications from respiratory tract infections. So that's always been true. Now with COVID, and COVID is different because COVID, when it gets into your body, it has the potential to invade any organ. So it can attack your lungs, your heart, your brain. It can cause long COVID. And so, by the way, treatment and vaccines reduces your risk of long COVID. So this virus is unforgiving. It's relentless and unforgiving. That's been my experience. And so, and we want to remember that the biggest predictor, the most important risk factor is just age. And so you don't want to think too much about it. If I'm over the age of 50 and I develop symptoms and I test positive for COVID, I need to be on treatment. So the idea is for all of us to be proactive. I would say there's an epidemic of our health systems are not sufficiently prepared. We have to remind them. We have to remind them. You have to remind them. And that's one of the things that we're going to be doing. President Biden just came out with a winter preparedness plan for the country that all of us have to double down on these preventive measures. And we're going to be doing that really in partnership with our healthcare systems to make sure that they're optimized so that their patients and residents have access to vaccines and treatment in a timely fashion. And so we still have a ways to go.
I have time for one question. There are a number from the chat. I'm so sorry, but Sunita, do you want to ask your question and then we'll move on to our next speaker?
Absolutely. Thank you, Sandy. Dr. Aragon, many older adults have a lot of medications that they're taking, which may have contraindications with things like Paxlovid. What are the best treatment options for older adults? What do I tell my mom or my grandma?
Or me?
Yeah.
Or you?
That's a really
or
good
my
question.
boss.
Yeah. So that's why it's really important to have a treatment plan ahead of time. Most people do fine with Paxlovid. Physicians are under prescribing Paxlovid. So that's one thing just to let you know. And because it provides a little bit of extra work, we have some tools to help clinicians work through that process of how to quickly check whether there's any interactions between medications, and it's better to do it ahead of time so things can move quickly if somebody tests positive. You can go to covid19.ca.gov/treatment, and we have some toolkits there, and basically look at that toolkit. And since this is a national call, people across the country can use that toolkit. It's not just California. We have information that's really applicable to every state in America. So take a look at that, and print things out. Go to your doctor, call them up, and say, I want to be prepared. Should I test positive? If you happen to test negative, let's say you have symptoms and you test negative at home, repeat the test. because these tests are not 100% the first time, because your viral load could be going up. So be sure to repeat the test, because it may be negative yesterday, but today turns positive.
Great. Thank you, Dr. Aragon. We're going to steal you, kidnap you, harass you till you come back again. You're a great presenter. There are questions for you, which I'm hoping some of our other speakers might look at and answer on the chat, since you have to depart.
Yeah, so I'm actually going to be able to stay. So I will stay and
Okay.
answer questions at the
Okay.
end when everybody else does, because
Or
I want to
maybe-
listen to the other speakers myself.
Okay, but if you could also see any questions you could quickly answer on the
Yes,
chat,
I'll do that.
that would be great. Okay, our next speaker is Jessica Lehman. And thank you so much, Ms. Lehman, for joining us. Ms. Lehman is Executive Director of Senior and Disability Action.
Thank you so much for having me. My name is Jessica. I use she and her. I work for Senior and Disability Action, which is a nonprofit community organization that brings together seniors and people with all kinds of disabilities to fight for change in the community and to build more of a voice for our communities that are so often ignored, and particularly focusing on people with disabilities and seniors who are also Black, Indigenous, people of color, who are poor, who are marginalized in multiple ways. So apologies, I'm not going to actually speak to exactly what's written on the agenda, but talk a little bit about the landscape as far as the ongoing COVID pandemic and how it has affected seniors and people with disabilities. So everyone may remember that COVID first hit people especially hard at skilled nursing facilities. And it took a while for that information to come out. But because it was older people, it was people with disabilities, people were in very close quarters. Nursing facilities are typically understaffed. And so there's not always the time and capability to make sure that there's a lot of protection between people. So people died in massive numbers. And of course, as people outside of nursing facilities started getting sick and dying, I remember when the headlines started coming out saying only older people and disabled people are dying, or that's most of it. And it was this kind of attempt to reassure the general public that they didn't need to worry, that it was only these certain communities that were really getting hit by it. But that other people, you might get sick, but you'd probably be okay. And that was one of the moments we saw in the pandemic of this huge division for people to say out loud or to say in newspaper headlines what I think many of us with disabilities and older people often feel, which is that we are seen as not a major part of society, that we are seen as something separate and something that is okay to ignore. And one of the major lines that folks started using, and particularly from the higher weight community, is nobody is disposable. And I think many of us very much recognized that people saw us as disposable. And we're seeing that even now, and we need to be talking about it, that there is this idea that, if you're vaccinated, you're probably fine being around other people, doing things inside, going back to indoor dining, going to big holiday parties, not wearing masks, except those with high risk conditions, right? And it's this like, well, we understand that some people can't do this, but everyone else can go out and have a good time. And it is creating further divisions in our community. And none of us from the disability and senior communities are saying, everyone should live in fear and no one should do anything. This has been emotionally and logistically complicated for everyone. But to say, let's talk about how we approach this as a community. And that means not saying these people do this and those other people can worry about themselves. So there's this lack of recognition that a huge number of people are at risk, whether They are older people, people with certain disabilities, higher weight people, and that all of us at higher risk are also part of families with other people, that we're part of communities, that we are connected in multiple ways. So one of the other major problems that came up early on in the pandemic was care rationing, and recognizing that hospitals were filling up, and that hospitals themselves were worried about what would they do if they couldn't treat everyone. How would they decide who to treat when? And so hospitals and states were coming up with guidelines about crisis care. And major coalitions came together of disabled groups, senior advocates, and higher weight people to fight against policies that would propose to determine which lives to save based on the number of years people had left, or even worse, what's called quality adjusted life years. And this is an idea that is very outdated, and a lot of people recognize that, but certainly not everyone does. Where the idea of the quality of someone's life is decided by people who are not disabled and who are not older. And this tremendous assumption that if you have, any number of disabilities, that your life isn't as good. And so if that decision must be made, better to sacrifice you than a young non-disabled person. And again, recognizing that disability is, disability comes up disproportionately in communities of color, in immigrant communities, in poor communities. These policies were not only ableist and ageist, but they were also very clearly racist and classist, and brought in every other kind of oppression.
Sorry to call a time component here, but if you could wrap up, and I have one very quick question for you.
Yes, that went very fast. I'm
It
sorry.
did too
I'm
fast.
conscious of talking slowly. I'm used to talking very quickly. I'll just add a couple quick things. We can look now at the drop in life expectancy that is continuing, particularly among communities of color. I'll find that stat to share in the chat, since we're running out of time. But I think we really need to take this moment to talk about ableism, oppression based on disability, and ageism, to recognize that they are real, and to not miss that opportunity to get people to see that they came up so prominently in the COVID pandemic and are still here. We need changes to our healthcare systems. We need to continue masking. There is much more public support for masking than our government officials like to talk about. And we need to be requiring masking in public buildings, in libraries, on public transportation, places where all of us go and where seniors and disabled people are even more likely to go. Thank you to the California Department of Public Health for continuing to require masking at hospitals and other medical buildings. I think most people find it appalling that the CDC ended that requirement. So now it's state by state. And the last thing I'll say, and I can talk more about this later if there's time, is that a couple of the things that our communities need are more outdoor events and hybrid meetings and events. And remembering the concept of universal design, that if we're looking at what benefits seniors and disabled people right now, that is also going to benefit everyone and create the kind of integrated, cohesive communities that we all need. Thank you.
So you're really warning us against segmenting out people with disabilities and older adults as if we're a special sector that can either be ignored or rendered disposable, but even worse, isolated. So much of what you're saying is that isolation is toxic for both groups. It's hard to know how to write about this pandemic of older adults without exaggerating the separation. So I would love any comments you could add in the chat box on that. And you, in a short space of time, provided a very provocative and challenge for us when we write about this subject. Thank you very much, Ms. Lehman. Our next speaker is Anna Acton, Deputy Director of the Independent Living and Community Access Division of the California Department of Rehabilitation. Thank you for joining us, Ms. Acton.
Thank you, and thank you for having me. So at the Department of Rehabilitation, we work a lot on ensuring that people with all types of disabilities have access to employment and community living, that they have the ability to live, work, and play where they choose to live. So I'm going to talk a little bit about the 28 independent living centers in California. So centers for independent living, as they're called in other states, well, they exist in every state. In California, we call them independent living centers. We have 28 of them. And again, they serve people regardless of what type of disability they have. So any type of disability, and regardless of what age the individual is. So this is going to include individuals from birth to death, older adults, children, and everything in between, right? They provide a whole variety of peer-delivered services. So services are delivered by people with disabilities to people with disabilities. These are consumer-driven, person-centered, whole person type of services. And
Ms. Acton, let me ask you, the interpreters are saying, speak
slow down.
Slowly. No,
I'm bad at that. Thank you for the reminder. So they provide a whole variety of services. And because of time, I'm not going to go into all of those direct services, but they do a lot on advocacy, individual advocacy, systems change advocacy, as well as providing those direct services to individuals. So during COVID-19, you know, we really saw this network of organizations really pivot what they typically do to identify unmet needs of people with disabilities and older adults. And Jessica talked a little bit to the piece of, you know, for many, it wasn't just older adults, right? It was some younger people with disabilities, certain health conditions that also put them you know, in a space to be disproportionately impacted by COVID-19. I'm a person with a disability. I use a wheelchair. I have type 1 diabetes. I'm considered overweight, right? So all these multitude of things will stack up for some people who are younger, right? That might make the COVID-19 experience a greater impact for them. So we saw these independent living centers really look at assessing these unmet needs. And I want to talk a little bit about those unmet needs, because not only were they an issue during stay-at-home orders and the beginning of the pandemic, right, but they continue to be these ongoing issues for people with disabilities and older adults. So we talked a little bit already, we heard about isolation and loneliness. This really is something that became really apparent early on and continues to be an issue. Jessica talked a little bit about that, right, in context to how people still are struggling with going out, if they are disproportionately, you know, at risk of complications from COVID-19, right? Their ability to interact in the community, connect with family, friends, and what have you is still being impacted today. So we saw the independent living centers really work to do wellness checks, reach out, get people connected to services virtually and in safe settings. We also saw an issue around the digital divide, we'll call it, right, for people with disabilities of all ages and older adults, right, to be able to access telehealth, to be able to access food and essential goods and services. We still have areas of the state that lack good broadband access, right? So what do you need to be able to access systems virtually or in a hybrid setting? We need the equipment, the computers, we need the broadband access. We also need the skills, right, to be able to utilize this equipment and technology to access services. So this is where we saw the independent living centers really provide equipment, provide support for people to access these goods and services virtually. Food access was a huge issue. We saw a lot of work being done to increase access to food for older adults, right? Home delivered meals, the Great Plate program was wonderful, but there were younger individuals with disabilities that didn't have access to some of those resources. So we saw the independent living centers put together their grocery bag delivery programs to address the needs of those at risk under the age of 60. We saw food pantries stood up, things they had never technically done before to really address those unmet needs. There was also a piece with transition and diversion. You did hear Jessica talk a little bit about how congregate settings, right, were disproportionately impacted. Again, we saw high numbers of people with COVID and deaths from COVID of older adults and people with disabilities. And so the independent living centers did a lot of work to help make that bridge to transition people from a congregate setting to home so they could be with family and friends during the pandemic, and also a lot of diversion services, keeping people from going into those congregate settings and prevent that, prevent them from going into those kind of higher risk settings.
Ms. Atkins,
Yes.
I have to ask you to wrap up.
Thank you.
And I would say the most important question is, what are you seeing now? We're looking at what seems to be a heightened risk for older adults and people with disabilities, even as many of us shrug our shoulders, don't wear masks, and assume we're in late stage pandemic times.
All these things that I've been talking about are still the work that's happening today, right? Because of the high rates of transmission, the flu and RSV and COVID-19, we're seeing this need, right, for digital access, for access to food and essential services in a safe environment, and being able to really ensure people get access to the vaccines. A lot of work went into ensuring accessible access to COVID-19 vaccine and ongoing, and the flu vaccine. And so we're seeing that outreach and education, assistance with transportation to the vaccines, and resources so that people can make informed decisions. So, while a lot of this started during the early steps of the pandemic, it continues. These same issues are still continuing for many people who are at higher risk.
Thank you. And believe me, this isn't just a one-off. What we're doing is identifying people we can go to after today's call to do follow-up reporting. So while we ask you to go so fast over this important ground, it isn't that we'll then ask you to disappear. We're connecting ourselves with experts in the field. So thank you. Now I'm going to go to Dr. Donna Benton for a discussion on family caregivers and how the heightened risk for older adults is affected by and relates to the role of family caregivers. Dr. Benton.
Thank you very much. Good. You know what? Good morning, everyone. Let me start by giving you a scenario. When you have a cold, when you have the flu, when you catch COVID, who's going to take care of you? You probably think, oh, that's going to be my spouse. That's going to be my adult child. Maybe you have a neighbor who's taking care of you. And anytime we do get sick, besides reaching out maybe to our doctor, it's usually a family member who is providing that care to us. And why is this important in relation to COVID? Because oftentimes the family member is younger, they might be working, and with COVID, they are going to have to take time off work to help another family member, an older adult who may have dementia, who may have multiple medical problems. And when they have to take time off work, do we have policies and procedures in place that help protect that caregiver who has spent now going on, what are we going on, almost 3 years, over 3 years, in trying to protect the older adult within the family across generations, but those family caregivers are usually the frontline workers for 80% of older adults who are at risk during this pandemic. And now with all the flu and vaccines, they're the ones that have to coordinate and get the person their shots and vaccinations. And when they looked at a survey nationally, it has actually since COVID, the number of family caregivers who say that they are having difficulty coordinating care during this pandemic has risen from about 19% in 2015 to over 26% in 2020. So the pandemic has made it harder for families to help the older adult function. We've seen an increase in the number of family members who are caring for more than one person since 2015. It's gone from 18% to 24%. And so as family members also are trying to coordinate and help somebody who might be may have COVID, and they're trying to keep them from getting COVID, from getting the flu, from getting any of these infections that make it worse, their own health has also suffered during this time. And we're seeing an increase of family caregivers who report that their own health has gone from fair to poor, and that's also increased during this time. So while I think what's nice is as we're looking to provide care for our older adults, we also need to make sure that those families and friends, because when I use the word family, I mean family of choice, not so it may be by blood, but it could be by affinity. We need to make sure that they're able to get PPEs, that they're easier access for home delivered vaccines. And I know in California, we do have programs where people can come to the home and provide vaccines. Very underutilized program, not marketed enough. We need to make sure that people understand how they can use paid family leave in California during those times, and their COVID leave ability during the time when they need to care for someone. So I know that we're running a little late, so I will save most of this for questions, but I just want you to think about, we know that family across all ethnic groups are the key and the linchpin. As someone said to me, which I like to quote what they said to me, which was that the families members who are the primary caregivers may be invisible, but they are indispensable for keeping and helping us manage COVID and this now, what is it called, triple pandemic that's going right now. The other thing is just, I want to point out that we do have in California, the California Caregiver Resource Centers, who are providing comprehensive services to family caregivers. And during the times when COVID started, we too had to make adaptations, like you had mentioned, for the disability community, in that our population, they weren't 65, but we had to help with bringing meals into the home so that they didn't have to expose themselves while they were caring for someone else. We've got PPEs for family caregivers because they weren't noticed as the essential workers, although they were caring for 80% of the population. And so we want to make sure that we want to help people have that balance, because many people are returning back into work and aren't working from home anymore. As people are back in the community, we need to be able to help families meet this pandemic. So
what
challenges.
What you're saying is that the infrastructure of support that family caregivers have provided through the pandemic is weakening as people have to go back to work,
Absolutely.
as people themselves are getting sick, and that you are beginning to reach out to family caregivers to make sure they know what resources they could be taking advantage of, which as a caregiver, you're often the last to think you deserve those resources. You're so focused on what your loved one or your their relative or friend is needing. So thank you, Dr. Benton, for those very important observations.
Yeah, so if you just even think about testing kits, they can only go to a household, I think you can get 4 in a household, but the caregiver may need, they'll use those up for the person they're caring for before they'll test themselves.
That says a great deal. Now we hear in a way from our host and keynote speaker, having laid out all these issues and challenges and having declared California as sort of at the front of the curve in addressing the needs and aspirations of older adults and people with disabilities. Susan DeMorris, what can you tell us that we're doing right? What are we doing not so well? And to what extent could California be offering models for other states?
Thank you. One thing you're doing, good afternoon and good morning, depending where you're joining from. One thing you're doing right is focusing on this topic today. So I want to thank all of the journalists that are covering this session. Ethnic Media Services is such an important partner in our work. We know the data, we now have data entering our 3rd year of this COVID pandemic. And a point of pride in California is that we enjoy one of the longest lifespans in the nation. But across the country, life expectancy has decreased. And it's decreased in particular in the Latino, Asian, and Black communities, and for those who live in the lowest income census tracts. So this topic is very real and very important. So thank you so much for your focus. I wanted to share two areas. One is here at the Department of Aging in California, and there are departments like ours across the country. There is an entire network of area agencies on aging in every state. And this is where older adults and family caregivers can get started with their questions and their concerns. And this is where they can begin to get linked to other services that help keep them safe at home, help them engage in the community and congregate settings like adult daycare, congregate meal sites, and also can help navigate and guide and make choices and decisions around board and care homes, assisted living, and skilled nursing. So we're very proud to have an adult information line here at the Department of Aging. Anyone in California can call this number to get started. It's 1-800-510-2020, and that can link you to all of the services I just mentioned and many more. In particular, home delivered meals, transportation, assistance with home modifications so that people can continue to live safely at home. Something we're encouraging right now, and it's a mixed message, I acknowledge, is we really want to combat social isolation. And part of that is reconnecting with family, friends, neighbors, and the community. And that's very difficult, we understand right now, with this triple pandemic. And so the way to safely gather and reassimilate with the community is to make sure that older adults and their family caregivers are vaccinated, boosted, and that their boosters have been updated so that they're caught up with the times. So that message we want to get across to reinforce what you've already heard today. We also want to make sure that people know that there are free testing kits available again through the Biden administration that can be delivered to your home, that we're seeing increasingly that health plans and providers are making Paxlovid available in the home by prearrangement. We heard that from Dr. Aragon, to have a treatment plan. That's part of it, is to be able to access that treatment at home if need be. So those are important messages we wanted to convey in December, and we know through the new year people will be gathering, and that is a very good thing. In California, we have a master plan for aging. Our governor, Gavin Newsom, implemented this by executive order nearly 3 years ago, And we're working across 5 bold goal areas: housing, health, equity and inclusion, caregiving that works, and this is our direct care workforce who are on the front lines and also who are at high risk of RSV, flu, and COVID. Also our family caregivers, as you just heard from Dr. Benton. And then our 5th bold goal is to focus on affording aging. We know for older adults across the country, be it housing, healthcare, utilities, prescription drugs, that the costs are escalating and are out of reach for so many older adults and their families. So with that, I will turn it back to you, Sandy, and thank you again to all who are joining for focusing your attention and resources on this population.
So thank you so much, Ms. DeMorris. An immediate question is, what is the life expectancy levels in California? Are we ahead of the country? Have we managed to avoid the lowering of life expectancy that we're seeing in other parts of the country?
Nationwide, and I'm not an expert on this, I'm referring to journal articles. Nationwide, there was a drop. California continues to remain, I believe, the 2nd longest lifespan in the nation, over 80 years of age. And it's a particular point of pride that our governor has focused on older adults with our master plan for aging, knowing that by the year 2030, we will have 10.8 million Californians who are age 60 and above. So it's a key priority and a focus area for our state administration and our legislature.
We have a very important question, I think, for us selfishly as journalists. This isn't so much about immediate issues for older adults and people with disabilities. It's a challenge this briefing poses for us as journalists, and it comes from Floyd Alvin Galloway. Ageism has always been an issue in American society. What can media do to erase this situation, which is heightened during the health crisis like this pandemic? And to address that, I also just want to say a huge thank you to Dr. Aragon and our other speakers for answering so many questions on the chat. But this question, it inclines me to want to ask each of our speakers, what do you think we should be doing to essentially, and I'll use these terms, combat the ageism, which is an ableism, or what our speakers have called the tendency to isolate older adults, and the very opposite of what these populations at high risk are facing. I think of a colleague who's now in her late 80s who says the biggest fear no longer for me is falling, it's being alone. And I just want to ask each of you, starting with Dr. Aragon, in a way, it's a very personal question. We're asking you to consider what could we be doing a better job at to address this issue, the vulnerability of older adults and people with disabilities.
Yeah, so I'll give you just one idea. That is, I remember several years ago when I was getting my training on implicit biases, and our trainer said to us, okay, what do you think is the number one implicit bias that exists out there? And people raised their hand and they talked about race and gender and all, and the trainer says, no, the number one implicit bias is ageism. So we're not even aware of it. And I think that's actually one of the biggest challenges that we have to realize, is that people do have a bias against people who are older, and it happens at a subconscious level. And so that means that we have to be much more intentional on how we design our systems, our culture, what we say. And we have to just recognize that even the best intentioned person may actually have biases against people who are older and may not even recognize it. And so I think that's just one of the battles we do have to fight, because people don't see it. It's a blind spot. They don't recognize it. So I'll start there, and I'm looking forward to hearing the other comments.
Great. Anna Acton, could we ask you that question, and also just ask you to draw on your own personal experience?
Yeah, so when we talk to people with disabilities about what their biggest barriers are, it comes down to the stigma that still exists within our society about the worth of people with disabilities, and just the stigma that exists that makes it hard to live, to get a job, and do the things that all of us would typically take for granted. So I would say that it's really important to think of disability and aging as part of the diversity that makes up our community. If we live long enough, we will experience disability, whether we're born with it, we acquire it, we age into it, okay? And so this diversity is what makes our communities stronger. And so I think media can do so much in ensuring the language that we use, how we talk about disability, how we talk about older adults is an empowering, right, type of messaging, right, that we start really honoring and you know, yeah,
That's I
diversity.
I
So.
hear you. If there's time, I'm going to circle back to each of you, because this just opens up so many important insights and questions. Jessica Lehman, what is your advice? And please draw on any personal experience you have.
Well, I already talked a lot about the stigma. I forgot to share that I myself have been disabled since birth. I use a wheelchair, and my disability affects my respiratory function. So I very much feel everything people have talked about with our communities being considered expendable. Advice for media: run stories, right? Talk about our communities, talk about connections with other people, right? So it's not just like, you know, the daughter of an older person talking about how much they care about this person, but get other people in the community, talk about how older people and disabled people are part of our community and have an impact, that when we're isolated, that affects everyone. Think about the language you use. Don't say the elderly, don't say the disabled. Those terms are very othering. I say, don't even talk about people as frail, right? I don't even like the word vulnerable. I understand what's behind it, but it's part of this paternalistic, often condescending way we talk about disabled people and older people. And don't use older people to reinforce ableism by talking about older people who are skydiving, right? You don't have to be skydiving in your 80s to still be a valuable member of society. Include numbers.
Really, okay.
Sorry, very quickly, that so many people are older and disabled, show that. And then I'm going to put in the chat, there's this fabulous Reframing Aging initiative from ToolWorks that everyone should read. Thanks.
Yes, it is terrific. Let me just say that in some languages, the word elder is a term of such honor and appreciation that at a recent meeting, a Chinese reporter pointed out to us that older adult in Chinese does not convey anything like the respect that the word elder conveys. So we have to look at this. We get what you're saying, but we have to translate it within our own specific language and culture. But
I agree with elders, absolutely. You know, talk to older people and disabled people themselves within that culture and that language, but don't use the elderly, right? It could be elders, it could be older people.
It's like the homeless, as if homelessness is the only thing that defines who the person is. Thank you. Now we go to Dr. Donna Benton. Any advice for us, Dr. Benton, on really trying to raise up the critical role of family caregivers? What is the best from your point of view, what is your best advice for us?
I think it, first of all, I think this format is a wonderful way to make that recognition. But even more so, it is important that policy and when we're working in the medical field, that they begin to recognize that the family caregiver needs to be able to coordinate these things, and that whenever they can, when you're talking to an older adult, it would be great if they try to not just keep it person focused, but family focused, and say, will this, is somebody helping you? Can we make sure that the scheduling is okay with them too? Because many times they're working.
Yes, I think that's something almost like a letter to the medical profession from family caregivers. We have schedules too. That's very important. Finally, Susan DeMorris, you're the driver of such an important set of initiatives and policy recommendations and actual policies. What are you most, I don't want to say pride, as if that's I take personal pride, I did this, but what are you most excited about that California is doing in this field? And perhaps if you have a personal recommendation for us as journalists, we would love to hear from you.
I love what's been said thus far. And I think when you look at our master plan for aging, I would center us on goal 3, which is inclusion and equity, not isolation. And as part of that, in this topic of ageism, to really look at the intersectionality that when we have 10.8 million Californians who are 60 and above, they do not all have the same experience. We're talking about perhaps 50 or 60 years of people. So to group them and lump them as if they are all the same is really doing a disservice to every one of them. We will have people who are working, who are retired, and people who are volunteering, and people who are being volunteered for. So I would just really urge, when and where you can, even in conversations as difficult as COVID, focus on the assets, the strengths, the contributions, and the value that this population brings to our homes, our communities, our state, and our nation. So really to focus on the positive.
Okay, that's an important consideration as we frame this session as, in a way, the risks to older adults and how do we do more to protect this population. And I think we can be our own worst enemy in how we try to present both the information of just the importance of the need for care, equitable health care for older adults and people with disabilities. And at the same time, the reason why that is so urgent, because we need everyone. The community is only as safe and healthy as the individual members who are at risk of being isolated. I didn't say that as eloquently as you all said it, but we got the message. And I want to just send a special thanks to each of you for taking your time to open up this subject again for us. Very eye-opening, and we look forward to following up with each of you. Thank you, Dr. Aragon, for leading us off. Thank you to Anna Acton, Jessica Lehman, Donna Benton, and Susan DeMorris, and to all of you for joining us on this briefing, to our media and interpreters. This conference now is closed.
Many thanks.